It was the last day of our trip, and it was on the second to the last chairlift. And the lady in front of me fell, and I went down right next to her. And I knew something was wrong. My son is an orthopedic spine surgeon, and he said, "Are you okay, Mom?" He said, "Is it your hip?" I said, "No, it's my back." I said, "Yeah, I think I'm okay." He said, "You could have a compression fracture and not even know it." My name's Elaine. I'm 73 years young, and I was diagnosed with osteoporosis 2 years ago. I was always following the rules. I took the calcium, I took the vitamin D, I ate a balanced diet, I did weight-bearing exercise, and I thought everything was fine until it wasn't.
As we skied away, she certainly made a comment that she felt something in her back, which really made me worry. Obviously, I'm a spine surgeon. I think of that right away.
Within a couple of days, I kind of knew that this was more, and an MRI indicated there was, in fact, a compression fracture. So I had a DEXA scan right after that. I was diagnosed with the osteoporosis. I think I had a flashback to my mother-in-law, and it was because my mother-in-law had picked up my 18-month-old son and literally broke her back and thought, am I gonna step off of a curb and break my ankle? Am I gonna, is it gonna impact my life to the point where I can't do anything?
Once we found out she had osteoporosis, it was very important that we got multiple providers involved very quickly, including her primary doctor and my partner, who's an orthopedic spine surgeon. And that way I could sit back and support my family, but allow them to take on the treatments.
After my diagnosis, the recommendation was that I go on EVENITY. It was explained to me that the injections will help build more bone. Just went to the infusion center once a month, and it was easy peasy. I just had 2 injections, and then after I completed the 12-month protocol, I had another DEXA, and the results of that DEXA were astounding. So I grew a lot of bone. Now that I finished my EVENITY treatment, I feel much more confident that I'm not going to be that person that breaks my back when I pick up my grandchild, or step off of a curb and break my ankle like my mother-in-law did. I've become a little bit vocal about the importance of having a DEXA, and I recommend as soon as you meet that criteria to start your DEXAs and get them whenever you can. I never really slowed down. I just keep on keeping on. I still love my gardening. I still walk. I still can mow my yard. And I have the belief that it's going to be okay.
Indication. EVENITY is a prescription medicine used to treat osteoporosis in women after menopause who are at high risk of fracture, or cannot use another osteoporosis medicine, or other osteoporosis medicines did not work well.
Important safety information. What is the most important information I should know about EVENITY? EVENITY can cause serious side effects, including increased risk of having a heart attack, stroke, or death from a cardiovascular, heart or blood vessel problem. Call your healthcare provider or get emergency help right away if you have any of these symptoms. Symptoms of heart attack, which may include chest pain or pressure, shortness of breath, feeling lightheaded or dizzy, or symptoms of stroke, which may include headache, numbness or weakness in face, arms, or legs, difficulty talking, changes in vision or loss of balance. Before you receive EVENITY, tell your healthcare provider if you have had a heart attack or stroke, especially if it has happened in the past year. Do not receive EVENITY if you have low blood calcium or are allergic to romosozumab or any ingredients in EVENITY. Before receiving EVENITY, tell your healthcare provider about all your medical conditions, including if you have a history of other heart or blood vessel problems, have low blood calcium, cannot take daily calcium and vitamin D, have kidney problems or are on kidney dialysis, plan to have dental surgery or teeth removed. What are the possible side effects of EVENITY? EVENITY may cause serious side effects, including serious allergic reactions have happened in people who receive EVENITY. Call your healthcare provider or go to the nearest emergency room right away if you have any symptoms of a serious allergic reaction, including rash, hives, swelling of the face, lips, mouth, tongue, or throat, which may cause difficulty in swallowing or breathing. Low calcium levels in your blood, hypocalcemia. EVENITY may lower the calcium levels in your blood. Your low blood calcium should be treated before you receive EVENITY. Call your healthcare provider if you have symptoms of low blood calcium such as spasms, twitches, or cramps in your muscles, numbness or tingling in your fingers, toes, or around your mouth. Severe jawbone problems, osteonecrosis may occur. Your healthcare provider should examine your mouth before you start EVENITY and may tell you to see your dentist. Ask your healthcare provider or dentist about good mouth care. Unusual thigh bone fractures. Symptoms of this type of fracture include new or unusual pain in your hip, groin, or thigh. The most common side effects of EVENITY include joint pain and headaches. These are not all the possible side effects of EVENITY. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Ask your doctor about EVENITY. Please visit evenity.com for full prescribing information, including boxed warning and medication guide.